Hi, everybody. Welcome. So this is just a really casual question and answer session aimed for particularly the parents of children with mild bleeding disorders. I've had a few questions come to me as I've been out and about. My name's Darian, by the way. I should introduce myself first. And I'm the haemophilia outreach worker for the Northern region. And as I say, yeah, I've had a few parents of people with mild bleeding disorders talk to me and ask and say, hey, we've got a few questions and it would be nice to have a bit of a Q&A with someone who knows these things. And because, of course, you know, the more severe bleeding disorders get, I guess, more of the attention sometimes, and they are generally on a prophylactic treatment. So the way that they get handled is a little bit different. So we have the lovely Vanessa with us, who is one of the fantastic nurses from the Haemophilia Treatment Centre here in Auckland. Hello, Vanessa.
Oh, hi, Darian. Thank you. Yeah.
So we're going to have a few questions. I've had some questions sent through to me that I'm going to fire at Vanessa, and she's going to give us some answers. And then if anybody else has some questions, feel free to just kind of jump in or raise your hand or make a noise. There's not that many of us online at the moment, so I think it's probably safe if you just want to unmute yourself and ask your question when there's a gap. So I'll start off, I guess, with one of the questions that has been raised already to give Vanessa something to begin with. And I think it's kind of a generalized question that has come up from a couple of parents of quite young children, more preschool or just starting school kind of age. You know, you've got particularly boys who tend to be a bit boisterous and like to run around and jump off furniture and do all of those kinds of active young kid kind of things. And when you've got a bleeding disorder, there's a bit of a question around, you know, how concerned should we be around that and how should we handle that? And so, welcome to some new people who have just popped in. So just to bring you guys up to date, we're just having a bit of a question and answer session with Vanessa, who's our wonderful nurse from the Haemophilia Treatment Centre here in Auckland. And yeah, just posing that question to you, Vanessa, when you've got young kids who really like to be active, run around and play hard, what do we do with that? How concerned should we be?
Hi, thank you, Darian. I think it's really important that they're allowed to continue to play, because the playing part of that age group is vital. That's how they learn. Yeah, but it's also important not to let them kind of headbang on the wall either, because they've got a bleeding disorder and that would cause trouble. Yeah, so I think sometimes with kids like this, it might just pay to just supervise them as much as you can, but still keep them as active as you can too. Yeah. So you don't want to keep them home from playing with their neighbourhood friends because you think that there might be a chance that they might hurt themselves. Yeah. So it is tricky, but for me, I would just say I would encourage as much socializing as you could. Yeah. And as long as they're not actually injuring themselves, yeah. And I think this age group there will be some injuries that will occur, you know. And then if you have any problems there, always contact your local treatment centre and they can advise you on what to do. But I think with bleeding disorders, it's going to be part and package, yeah, of growing up, yeah. But you don't want them to feel left out. Their well-being is also very important, and it's important to feel included in a lot of play.
So yeah, it sounds like, you know, you're advising actually let kids be kids, but just keep an eye out. Is that kind of?
Yes, for the mild group, yeah, I would, yeah.
And so when you say, you know, call the treatment centre if there's an injury, what should we be looking for? You know, is it just a little bump, or what are the signs that, okay, I should probably give them a call on this one?
It does get tricky, actually. This is the trickiest age group. Yeah. Oh no, the trickiest. Yeah. With all of the bleeding disorders. Yeah. It's an easy call for severes because it's obvious. Yeah. But there's a lot more assessment that goes on with the milds, and sometimes the milds have the biggest range. Yeah. But the closer you are to your factor, yeah, level, your baseline level, yeah, the more likely that you will need treatment. Yeah. But I would be keeping a close eye on, yeah, head traumas. Yeah, they're really important. Yeah, to you probably have to phone us quite quickly about that one, and definitely we'd like to probably get treatment on board. Yeah, or any big traumas. Yeah, to muscles or joints that, you know, we like to know about. Yeah, I mean, little superficial things like cuts and scrapes or bruises, you know, they can be all managed at home, and we can advise you what to do. Yeah, but some bleeds are more important than the others, and any big head knocks, yeah, I think should always be followed up, yeah, medically.
Cool. So a head bump, we definitely want to check in. And it sounded like you said having an awareness of what your usual level of factor in your particular case is going to be helpful in terms of assessing how urgent a thing is likely to be.
Yeah, because when you're looking at the mild age group, that you know, you might have a baseline of about 5%, which is going to be very different from how we treat people with a baseline of 33%, for example. You know what I mean? Yeah.
Okay, so it's really helpful to know what your baseline is and talk to your specialist or your nurses about that ahead of time, so you've got a good grasp of what that means for you and your child.
Yeah, yes, yeah, that's right. Yeah.
Cool.
Sometimes it depends on the age of the child too. You know, toddlers are very different from, you know, people who are 10-year-olds. They're into different things. Yeah.
Okay, and I guess that leads on to the next question, like when they get to school age, how much information do we need to be imparting to the teachers in the school, and how much of the fear of God do we need to put into them about looking after our kids?
Oh, okay. I think every school teacher, yeah, should know if they've got a person with bleeding disorder sitting in their classroom, yeah, because they will need to act quite swiftly, yeah, you know, if there was an accident, yeah, and they can't dismiss things either, because sometimes dismissing things could be growing into quite a big problem later on, yeah, and sometimes these kids will pay, you know, with their time, and a simple bleed that could have been treated quickly, yeah, has just ended up being quite a big problem, yeah. So often, you know, when they first start kindergarten, you know, or preschool, you know, or in, you know, or new school, we tend to. Oh, I thought that was your job, Darian. Sorry.
yeah, I was actually going to add to whatever you said, because absolutely. So bring your outreach worker into this process when your kids start school, because that is part of our role, is to go in and talk to the teachers, talk to the schools, and make sure that they have that information.
Yeah, because education there is really important. Yeah, and I'm sure that most teachers are happy to support, yeah, whatever's put in place. Often there's a plan that follows too, and there should be prompting early communication with the parents, so they're aware and can look out for things too. Yeah.
Yeah,
caught short on time. You know, I know that Kat, our physio here, have also been into schools to help. Yeah, you know, we can do that too. Yeah, we don't mind our number being given to the school. We can walk and talk them through this, you know, behind the scenes.
Cool. So that's a really useful thing to know as well, that the school can actually ring the treatment centre, and, you know, if something's happened, they can just check in and see, you know, how serious that needs to be taken. So that's good.
Yeah, very happy.
Excellent. And certainly from what I've seen in dealing with schools, you know, they're very good at having a file for kids with any kind of special needs, and often the duty teacher has something that they carry with them with some cards or something like that, and they can flick through and go, okay, here's the issue with this child that I need to be aware of, and they'll jump on that stuff really quick. But it's just a matter of making sure that they're aware of it, eh?
Yeah, no, absolutely. Yeah.
Cool. All right. So I had another question that was sent through ahead of time, and then we'll just kind of open it up to anybody else who's here and has some questions they'd like to ask. So this one was around, how do you manage someone who's a teenager, treats on demand, and has a lot of quite significant nosebleeds? So how can we deal with those?
Oh, okay. Yeah. Thanks, Darian. I think this question came from someone who might live in the country or rural. Yeah. And that can be quite challenging because you're quite isolated with bleeding disorders in those areas, and it just adds an extra layer of difficulty onto it. Yeah. But our general information, what I provide with our patients here is to treat the nosebleed, you normally just gently blow your nose to clear the mucus and any unstable clots in there. And then we advise just to tilt with your head slightly tilted forward. Yeah. And I sometimes advise to put an ice pack on the back of their neck. Yeah. Because that coldness just helps constrict the blood flow from the vessels. Yeah. And then apply firm pressure at the bridge of their nose for at least anywhere from 10 to 20 minutes. Yeah. And no unplugging. Don't just hold that there for that amount of time. Yeah. And then you can, after that time, bring it away and you can assess it. Yeah, again. But if it's still there, just repeat that again. Yeah. And then if you're not having any success in trying to stop that, you will have to go for treatment. And I'm hoping that most people with bleeding disorders are kind of well stocked with their tranexamic acid tablets. Yeah. And just take those that have been directed. Yeah. You also might need to give yourself a treatment. Yeah. Whatever your factor type would be. Yeah. And if they're mild Hem A's or von Willebrand's, yeah, you can also use DDABP, which is a desmopressin. So if you're having trouble getting your access in IV, this is also a good plan to go for a backup because it goes subcut. It can go into your tummy. Yeah, so it's a little bit easier to get in. But if you're going to go with that option, I would just watch your fluid intake. Yeah. And if it's reoccurring, this nosebleed, we may need to consider an ENT referral, because sometimes they tend to cauterize or do some packing to assist. Yeah. But I would just ask this person, you know, if their nosebleed, how long are their nosebleeds? Are they from both nostrils? Yeah. It's kind of important information to get. Yeah.
Okay.
But
So,
yeah, if there's a big blood loss, I would be looking at monitoring their iron level too. Yeah. Because that can tumble down over time. And then if you're trying to look at preventing it, yeah, it's better to stay out of a dry room that will dry your nostrils out. Yeah. And when you start to blow, then it starts and then all the gates open up. Yeah. So keeping that nostril nice, or both, one or both, yeah, nice and moist, sometimes with petroleum jelly, yeah, that helps just lubricate them. That can make a difference. Yeah. But in regarding if this person's having trouble accessing, or just given the COVID crisis at the moment, that it's really hard to plan things like getting your learning how to access underway. Yeah, that can be harder. Yeah, maybe that's something that we should talk about as nurses to see if we can do something online. But I would just advise to Zoom with your local centre to see what they can come up with, or your plan B might just to include someone from your local nursing or medical area, like your GP or your community nurse, someone with some IV access skills that you can go to if you get caught out. Yeah. but I think your training needs to start, yeah. So, and you can go at your own pace, and yeah, everybody misses. Just remember that when you're under a lot of pressure, yeah. From memory, there were some old kits that were floating around, yeah, that you could actually play with, yeah. And it might be good to see if we can find one of those so they can actually go through the steps and you know, and walk and talk, yeah, through with BJ. But yeah, when you start, just I would just break it down into parts, you know, encourage the child to be mixing their own product so they will know how to do that. Walk and talk them through how to put on tourniquet, yeah, locating veins, yeah. And this can be happening for years before they actually step up and want to take over that access. And then yeah, teaching them the actual technique of it. Yeah, some people take to it quite quickly, other times it will take a while. It's just more encouragement, yeah. And then yeah, the aftercare of the veins quite important, and just troubleshooting when you do hit some, yeah, issues, yeah. But we're always on the phone. We're always happy to help you, to walk and talk you through it. But if you're under pressure first thing in the morning and you can't find a vein and you've mixed up your product, just always feel free, just pop it in the fridge and say, we'll deal with it later. Yeah, that's quite fine to come back to. But I do think, yeah, this once a year training, I don't think it's enough. Yeah. But I mean, I don't know the actual demand that's required, but yeah, like well, I've got a couple here that are waiting to start too. Yeah, but sometimes we just bring them into the centre, yeah, and we just start slowly and we go from there. But it's not always easy when you're a long way from a centre either. Mm-hmm. But that's what I would do. Yeah.
Cool. Oh, thank you. That sounds like a lot of stuff can help with that situation. So that's really good. So I see we've got a few more people who have joined us. So I think at this point we'll just kind of open it up to everybody. So if you have a question, we're going to be a little bit casual, but obviously we'll have to be a little bit careful that we don't talk over each other. But yeah, if you do have a question, please unmute yourself and pop it out there for us, and we'll see what Vanessa can advise. So anyone have anything that they would like to ask at this point?
Well, I'll ask something.
Excellent.
Hi, I'm Rosie. I'm the Southern Outreach Worker. Hi, Vanessa.
Hi, Rosie.
How are you doing?
Yeah, good. I'm
good. I look forward to meeting you in person. My question was, and I guess it's probably a combination of just common sense, but I know that some of the young people in my area are wanting to go away on school camps and, you know, getting involved with things that might even, not at the moment, obviously, but, you know, send them overseas for a week, like, you know, school choirs and that sort of thing. And I guess for those longer periods of time, you know, whether it might even be a situation of them wanting to go on like a hiking trip that requires them staying in dock huts and, you know, quite isolated in a way. Is that still entirely possible? I mean, I'm assuming that it would be, but I just wanted to get from you, you know, what some of the precautions you would put in place for that kind of situation.
We would always encourage our patients to go on their schooling trips. Yeah. It's unlikely they'll be going by themselves, so they'll have some, yeah, parent support, yeah, in place, yeah, and to take their factor with them at all times, yeah. We often follow up with a letter to the school and in cases of emergency, this is what to do, yeah. But I think for kids, it's really important that they feel included and involved and don't have to be sat on the sideline, yeah, because it's quite good to bond with your peers too. So we people at all stops. I mean, if the child is really keen to do this, yeah, we would support them 100% in doing it. Yeah, within reason. Yeah, we wouldn't want them going rock climbing. yeah, when they've got a severe on your hand, yeah. But yeah, I just think that we should try to do as much as we can to support that.
Even if they're in situations where they are isolated from emergency care, it's just about bringing, you know, for example, transacid tablets with you so that you've got that backup plan. Is that the idea for your mild cases?
Yeah, for our milds, like we take that into consideration with, like often the parents phone us and say, this is their school trip, this is where we're going. And we assess, you know, where they're going, what they're doing. Yeah. And sometimes if they are going quite remote and doing something quite, you know, out there, you know, there might be a chance that there might be a good argument to say, well, let's give them a treatment before they go so they get their levels up nice and high.
Yeah. Awesome. Thank you very much.
Just something to consider, but I think it's important that they do it.
Yeah. Great.
And even non-bleeding people, they have accidents too in, you know, in quite remote areas. Yeah.
Exactly. Yeah.
Yeah, so that's how I'd handle it. Yeah.
Right.
Or fucking Rosie too. Yeah. You're new to that role. Yeah.
Yes.
Yeah. Oh, that's great.
Yeah.
Yeah.
Cool. Does anyone else have questions they'd like to throw out there? Here's your chance. Ask Vanessa anything.
I'll jump in. Hi guys. It's Kylie Andrews here. So I've got a 12-year-old who's he's got factor B, and I think he's only had one lot of treatment, maybe sort of 18 months ago. Just a question. So during lockdown, we actually had he had a small bleed in his calf. And so we just rested with ice and that sort of thing. But he and he sort of seemed to be right. So we were like, okay, cool. We don't have to come into haemophilia into Auckland. So that was cool. My question is just, I was listening to about the tranexamic acid. Is that, so we don't actually have that on hand. Is that something that I should be getting as a precautionary thing just regardless, or?
When we see our patients that come through, most of the time, we do like our patients to have some type of access to it, because it is something that it's nice, particularly for that age group. It's easy to swallow and it will help, and if there's any gum bleeding or any mild bleeds that happen, it just will aid in recovery.
Because I was going to get, he's got still sort of a hard little sort of I guess marble side rock sort of sitting there in his calf, so I was going to get him to have some physio once we got into level 2, so I might come in and see you guys and maybe get some of the tranexamic acid then. We've actually if we need to, my dad also has product available, so in his fridge, so although we haven't had to use it before.
We can always send you scripts. That's one thing in lockdown that's kind of cleared, is getting scripts out to patients just became very easy. If you just text us and tell us which pharmacy,
that sounds cool. Thanks, Vanessa. I will do. That's great.
And Kat at physio, she's still seeing patients in level 3. And if you have any questions, she's also happy to Zoom or take a phone call.
I might. Cool. I'll get in contact with her. My dad did give me your number, so that would be great. Thank you.
That's all right. It's just different, but it's
I was sort of just holding off because not wanting to head into the hospital, to be honest. But that sounds good.
It's a bit scary, the hospital at the moment. So it's only about one way in and one way out.
I think it's just even getting the exercises, just getting him back into movement again is the main thing, and just cool. Thank you.
No worries.
I can vouch for the fact that the hospitals are handling the whole COVID thing very easily, very well. I had to go in last week for something, and they're very, very strict and very organized in terms of keeping everyone separated and protected. So if you do need to go in, even at level 3, go for it. Anyone else have some questions that they'd like to throw Vanessa's way?
Hi, I'm Cameron down here in Wellington. I've got Henry, 3-year-old with mild haemophilia. Just hearing about I think it was called Trans Am, and just having medication on hand for minor events. At what age would we start looking at that?
We give our peds population, a dose, but it will be watered down from the adult version, So your pediatrician, or do you see do you have a heme guy down there?
Yeah. No, they've been fantastic. It's just something, I heard about through here, and I knew that it was something we might consider later in life. I just wondered if there was an age limit to when you would take some for issues.
No, we start quite young. If someone's coming into theatre, we definitely probably cover them with their factor and tranexamic acid. And sometimes with our Von Willys population, with their heavy nosebleeds, it's always a kind of a preferred option to go to. So normally gum bleeding and nose bleeding and things like that, it works quite nicely for, you don't have to have a huge supply, like you don't need 100 tablets, but the next time that you see your hematologist, just you can ask them.
Thank you very much. We'll definitely do that.
No worries.
Excellent. Other questions? Who's got anything else that they would like to ask or even just comment on? It's always good to hear how things are going for everybody.
Hi, I'm Louise, and my son's actually older, but I'm sort of doing this to represent the family. Physio, should we be using our haemophilic physios proactively?
Yes, they're such a great resource, and I just think they've been well chosen for their roles. I think I've met most of the physios in New Zealand, and they're excellent.
So are they sitting around twiddling their thumbs? I sort of feel as though, like if he's had rebleeds in a particular area, should we, for mild haemophilics, be bothering the hemo team, with preventative stuff? I sort of, yes, but okay, so preventative is okay, particularly in the case of a rebleed. Okay.
So our physio Catherine, who works here, she's always happy to be contacted. She can give some good advice.
No, she's been good in the past, so that's good. And who's the physio in Christchurch?
I'm not sure. Sorry, I know there's Abby down the road from us in Hamilton.
Okay.
Oh, I just can't remember her name. Sorry.
Okay.
I can find out for you, but I know she's very.
No, that's okay. I just thought it's probably for Mr. Mitchell on there. If you're from the South Island, aren't you, Mr. Mitchell?
Preventative.
Yeah. But no, that's all good. That's all good. I was just trying to introduce and quantify how encouraging should I encourage my son to go and get physio. That's all. Yeah,
especially if he keeps really bleeding in that area, I would encourage him to. But sometimes it's the last thing they want to do. But
because it's sometimes for that age, the 20-year-olds, it's slightly self-inflicted. So they may not want to admit what they've been doing that created the bleed.
That's good at all. So she won't be hearing anything she hasn't heard before.
Okay, that's good. And thank you that tranexamic acid, I've heard of it before, but I didn't realize it's good to know that perhaps it could be used as preventative and have it on hand to help a situation, particularly for mild, when you don't know whether it's really worthy to receive factor or not. So that was good information. Thank you.
So I wouldn't be taking it if you're not bleeding.
No.
If you do think that there is a bleed, it is kind of handy to have on hand.
Yeah. Okay, thank you.
Yeah, no worries.
Yeah, I think as Vanessa said, physios and all these medical people have seen all this stuff before and are really non-judgmental. So I would definitely encourage people to engage, even if you're a little bit embarrassed about whatever you did to cause a bleed. They're not going to give you too much of a hard time. They're just going to get on and help you fix it. And I think also, there's something you said resonated with me. I think a lot of, maybe it's a Kiwi thing, or also amongst the mild people, there's this thought that, oh, maybe I'm taking up space that is better spent on someone else. But actually, if the medical services aren't aware of you and your needs because you're hiding from them, then there'll never be the capacity because they don't know it's needed. So step up, put your hand up. Absolutely.
Okay, thank you.
You're important to us, and I know that it's tricky with you guys. It's a lot more assessing, that like on from your side, but we're always happy to help you.
Yeah, thank you, that's good.
Does anyone else have any other questions or comments? I think I'm looking at the screen, and I think just about everybody's chipped in at some point. So if there's not anything else, we might look at winding it up in a moment. Speak now or forever hold your peace.
Oh, good.
Okay. Well, in that case, thank you everybody for coming along and joining in and asking your questions. I mentioned at the start of this, but some of you may have missed it, that we've recorded this session and we're going to put it up so that other parents can just watch it later. And because a lot of these questions are things that come up for a lot of people. But I am aware that some of you have contributed some information that is about yourselves or your kids. And so if you're not wanting that to be shared, do let us know so that we can edit it out. But it would be helpful, I think, for lots of families to see what everyone goes through and see that their questions are common questions, because we get them a lot, because this is the journey that everyone's on with mild bleeding disorders. So again, thank you so much for all of your participation, and a huge thank you to Vanessa for taking the time out of her day to come and be our resident expert in the hot seat and give us all the answers here. So thank you very much, Vanessa.
Oh, no worries. Nice to see you and meet some of you. Take care, everybody. Hopefully our lockdown will end sometime soon. We might get to meet each other.
That would be good.
Thanks, Vanessa. Thanks, Darian.
Okay.
Thanks,
Bye.
everyone. Enjoy the rest of your day.
You
Bye.
too.
Thank you.
Guys, bye.